I am referred to the surgeon. He's like, yep, it's definitely a hernia. We can operate on you as soon as next week. Go into surgery, wake up. They tell me, hey, we're going to have you spend the night in the hospital. And I was like, oh, why? And so they did tell me that in the hospital that it was a tumor the size of like a smashed tennis ball. He's like, I'm 99% sure it's a sarcoma. I was young. I was still living at home, had just graduated about a year previously. I had very little symptoms. I had a bunch of friends who were meeting in Madison, Wisconsin for a weekend. Ended up getting the flu from that trip, not enough sleep. And then got such a bad like cough that about a week later, I felt this like bump in the lower abdomen kind of / intestinal area. And my first thought was, okay, I clearly got a hernia because I was coughing so badly from this cold. And then of course, if you go to Google, it says that's a hernia. Eventually got to my general practitioner and he was like, yep, it's a hernia. Here's a surgeon. Go schedule. It's a very routine surgery. I think there is something to be said about your body just knowing at the end of the day, but I was a little distraught about going into the surgery. I was like, you know what, we're gonna ignore all the fears. Halloween, I'll remember that because my mom was like, are you superstitious? And I was like, no, not at all. I just want this thing like out. Like, again, it's a nuisance. They did tell me that in the hospital that it was a tumor that was found in my left abdominal wall, superficial muscle, like the six-pack abdominals. He's like, I'm 99% sure it's a sarcoma, but I can't tell you for sure. Like, we have to send it to pathology. Because it was such a big tumor, it took about 2 weeks to get that diagnosis. But those 2 weeks were tough because I think there was a little part of you that hopes like, oh, maybe it was just like a fluke and it's this weird thing and it's benign. They call it and they're like, it's an incredibly rare cancer. It's called alveolar soft part sarcoma. So he did correctly identify it as a sarcoma. And that was my official diagnosis. Clearly, you go to Google and it's so rare that they're like 80 people get diagnosed with it a year. I had no hope of even finding someone nearby that I could like chat with regarding it. Given also the fact I was 24, you don't see a lot of 24-year-old cancer patients because it was a sarcoma. It's this rare sarcoma. There's no known cause. This just being a complete fluke was frustrating, to say the least. We waited to see if the margins of the tumor were clear, to see if there were any cancer left in that muscle region, and they were not clear. So regardless, there was still cancer left in the body. It was pretty clear that this was so rare that it would require a larger cancer hospital. First thing that came up was Dana-Farber in Boston. They told me that I was going to do radiation on the area to really just like kill any cancer cells. And then I was going to have a very, very massive surgery that they would cut out the whole area, all of my left and some of my right abdominal muscles. February, I had a fertility surgery as well, just to kind of prep for that radiation because it is so close to the ovaries. So the choice was either freeze my eggs or remove one ovary, freeze it, and then pin the other ovary up out of the radiation zone and hope that that one doesn't get damaged. And I'm 24, I'm single. I've always wanted children, but have no prospects. I'm not thinking about family planning at all. To me right now, it's more important to preserve my like natural hormonal cycle. Like I don't want to go through menopause at 24. But that was a very tough decision because I remember looking over at my mom because I'm like, can you make this decision for me and start radiation for a month? I laid on a table for 20 minutes every day and then laid very still. And that was it. I didn't have like a brutal experience as far as side effects.
All right.
And then that May had the massive surgery at Dana-Farber where they removed the radiated area, which ended up being, I think it was like they said it was a full piece of paper worth of my abdomen, that inner part of muscle. So huge chunk just up and lifted. They did the removal, put mesh down, and then stitched me back together. It was a very intense surgery. 2 weeks after, had to be like in a beach chair position. So I wasn't ever allowed to even like fully stand up. The suture broke open, so I had a whole, it was a mess. I got the flu about a week later. And the idea of throwing up or coughing or sneezing, anything that like puts pressure on your abdomen is a terrible first experience. And it was 6 months of like changing Band-Aids every 6 hours and cleaning it out. And you don't ever want to be that comfortable with yourself. I've decided like, you don't ever need to see your insides. I'm a 24-year-old woman and my body does not look like any other 24-year-old woman's body. And I need to make amends with that. And my body can't do the things that other 24-year-old women can do, because they did say the surgery would prevent me from most likely carrying a child. That was definitely the acceptance part. But at that point in time, there was no sign of metastasizing. In my mind, it was very easy to keep a positive mindset, because you're like, this is it. Once I recover from this, like, we're done. I threw a big remission party, a huge one. But then May of 2024 went back for my normal 3-month scans, and they were like, the nodules in your lung, we believe, is the cancer, and it metastasized. I was sitting in the room, and they're always such stuffy rooms for some reason, and I'm with my mom, and we, like, it's been so routine for me to come every 3 months. My oncologist came in and pretty much is like, it's the cancer, and says it much more gently than that. And I just immediately started crying. I was like, I'm so sorry to my mom, because if I feel bad for one person in this whole situation, it's two people, it's my parents. Cried for a bit. I needed to get water, like very close to a panic attack. Just was not what I was expecting whatsoever. Clearly, like, your worst fear realized. They said immunotherapy is the next step. My cancer can be treated with chemo. But they wanted me to wait a year before starting the drug, because they're like, your tumors are still so small that if we gave you the drug, we wouldn't be able to tell if it was working or not. They were worried that the drug would cause inflammation of the tumor, and then it would look like it's growing when it's not. I had a great year, honestly. I slept better than I've ever had slept the whole year, because I think there's something to be said that if your worst fears realize, there's nothing to be scared of anymore. I'm not going to bed and having nightmares that the cancer's back, because it's back. In a weird way, it was resolved. All of this stress of the previous year and emotionally dealing with that, it was resolved. When I saw my new oncologist, he's fantastic, and he was like, we're going to start immunotherapy in the summer, but do you want to freeze your eggs first? Because we don't know. We don't know what the drug does to ovulation in general. I did do a one full cycle of freezing my eggs. I even remember asking my oncologist when he suggested it. I was like, am I going to live long enough to have kids? Is this worth it? And he's like, some people live a very long time on this drug, so I wouldn't close any doors. I started immunotherapy at the end of July. My liver freaked out from the first dose of drug. It was, I guess, not happy with it. They said that's incredibly rare, but I'm hoping that's a good sign. They said that potentially that means it's really doing its job. So I had to stop immunotherapy immediately and then go on steroids for about a month and a half to bring down those liver levels. And then before restarting immunotherapy, I was like, I want to get this surgery pretty much during this whole time, starting last January. The hole that was left in my abdomen, it was like a scar, but it was that big. It was a hefty scar. So the mesh was gone. So now my intestines were poking through that hole. There was still a layer of skin, so it wasn't you could see the intestines, but you could feel them through it, and it was like a lump. I went in to see my head surgeon, and I was like, I can't carry more than 15 pounds right now, and I have a nephew, and he's over 15 pounds now, and I want to be able to carry my nephew. And he was like, I'm gonna do a surgery where you don't have any limitations afterwards. And pretty much what happened is they put the mesh in, everything was good there, put a vacuum seal over it, and then they cut my side open and lifted it, and they were going to twist it to cover the whole part and then shut me back again. They were able to fully twist it, but they were like, we don't know if this part of your skin is going to fully come to life again. And they're like, and if it doesn't take, we are going to have to go cut into your legs again. So they're like, in order to bring it to life, you're going to get leeches. And I was like, oh my gosh, what's that? They're like, leeches. And I was like medieval leeches? And they're like, yeah. So I had leeches on me every 4 hours. I'm on bed rest, I can't move. I'm watching them suck all the blood out of this flap that they put on me. But they did their job, and the flap came to life. So I'm very thankful for that. And now I have no limitations in that way. I waited to restart the immunotherapy. And so I've been on that now since December. Within 2 sessions, they didn't see any tumor growth. So that's been great. I am here for the journey now. I don't know what's going to happen. I've just made a lot of peace with that fact. Have learned to make friends with the unknown. which is really big because 3 years ago I could not have said that. I'm not a big fan of the whole like, you're so brave. But I remember like a quote that I saw that really changed things for me is, even if you have like fear, do it afraid. And I think that that's where courage stems from. If there wasn't something scary, then there's no need to have courage. All of this journey, even like if you're scared of needles, which sometimes I don't like it, you're gonna have to do it afraid, and that courage is well earned, and don't let anyone take that from you.